Hello everyone, I am Dr. Sanjay Pandey at the Kokilaben Dhirubhai Ambani Hospital. I wish to make you aware that at Kokilaben Hospital, we have this new concept clinic called Nocturia and Enuresis Clinic. It was possibly a demand from the society where individual patients in their 40s to 70s would come and say, I have to get up all night. I am awake all night because I have to get up and pass urine. And we as urologists would look at lower tract symptoms in isolation with symptoms which are more common in the day. And their agony at night could never be fulfilled. This was the genesis of starting this Nocturia and Enuresis Clinic, where many patients in their elderly age group, because of changes happening in the body, hormone changes happening on multiple medications, being diabetics around, having a fragile sleep, would be awake for multiple reasons and would attribute that possibly to the urine around. We also know that benign prostatic hyperplasia or BPH, which happens to middle-aged and elderly men, also is one of the reasons why you get nocturia. So nocturia is getting up more than 1 to 2 times at night. That means multiple times at night. Sleep getting disturbed, not being able to go back to fuller sleep that was there. And these patients have a very fragile sleep, which means that their next day is almost broken apart. They are not in shape to be able to perform that. And for people, this has become a life. They are awake whole night, getting up multiple times to pass urine. Many a times they would leak urine before they reach the washroom. The Nocturia and Enuresis Clinic at the Kokilaben Dhirubhai Ambani Hospital in Mumbai at the Department of Urology has actually seen approximately 400 patients since we started this 1.5 years ago. We look forward to more and more patients getting an awareness that nocturia or getting up multiple times at night is a treatable phenomenon. Elderly patients do suffer from nocturia not only because they have got a prostatic enlargement, but they also have got something called as nocturnal polyuria. That means the production of urine is more at night than in the day, or more at night now compared to what it was before, only because of the changes that are happening in the body. This is because of the hormone changes of arginine vasopressin, which takes its due opening more in the elderly age group. That means you produce more than 33% of your entire output in the night time. That's the time you want to sleep for 6 to 8 hours and you're awake trying to empty your bladder. Not easy for you. So in such situations, we need to identify such patients who could have other comorbid phenomena. And what could it be? It could be uncontrolled diabetes mellitus. It could be uncontrolled diabetes insipidus. It could be a decompensated or uncompensated heart disease. Many patients with heart diseases will have nocturia, and not only about prostate issues. Women may have estrogen deficiency. Many people will be drinking water more at night. It could be tea, coffee, alcohol, beverages, and that could cause more production of urine at night, something called as primary polydipsia. So nocturia is a phenomena where people get up multiple times at night. They don't know where to go to. And we as colleague urologists would only look at prostates or lower tract symptoms and would identify those things around, forgetting the agony that the patient goes through at night. So in today's world, there's a treatment of such patients around. We could identify the causes of such patients, being a part of the multidisciplinary team, look at the other aspects which could cause nocturia and help them to get treatment, an active and a better life at night. Because at night you want to be in the bed, resting, sleeping, getting the full night sleep and be able to celebrate the World Sleep Day every day. I must tell you that March 17th every year is celebrated as the World Sleep Day. When you sleep, you want to sleep. You want to have a good active rest on that. So you get up and do better the next day. Enuresis or bedwetting is unfortunately another phenomena which afflicts more commonly the growing age group, the children and the adolescents, where they do bedwetting. So enuresis or bedwetting is a phenomena which children are afflicted with, both boys and girls, in their age group anything between 5 to 15. And in that age group, parents don't know what to do. They attempt treatment, they attempt various alarms, but finally we need to identify that enuresis is also a phenomena which should be treated in time. If we don't do it, these children go through an agony of, being loss of self-confidence, not being able to perform well in schools. They're not confident all through because at night they would sleep, they would get up one or multiple times, possibly would not get up because the alarm bells have not rung, but they would wet the bed one or multiple times. So the entire confidence is in a different level altogether. At Nocturia and Enuresis Clinic in Kokilaben Hospital, we identify such patients, both the children who are bedwetting and adults who are bedwetting or getting up multiple times a night. And these patients are treatable. It's to identify their causes, it's to identify them, get in association with their relatives, for the children, their parents who help us out with the alarm bells and with identifying the child, because we need to grow confidence of these people who are bedwetting, who are leaking at night, who are not able to sleep because they get up multiple times at night. These patients deserve a better treatment. So back at Nocturia and Enuresis Clinic in the Department of Urology, in the second floor at the Kokilaben Hospital, we look forward to treating more patients with this phenomena of getting up multiple times at night, with this phenomena of bedwetting, and for them who have not got their treatments that they have been trying to seek. Thank you so much.